And so I find myself at the age of 54, kissing 55, I'll be that in December, recognizing that there are things that have been happening to me that I wasn't prepared for, that no one told me about, or that I was too arrogant to expect that it would happen to me. So the importance of it is recognizing it. You know, I see things through the lens as a believer, a Christian. And so in 2 Timothy 1:7, it says that God didn't give us the spirit of fear, but of power and of love and of a sound mind. God gave us a sound mind. But in many instances, when he gives us things, we have to do something to obtain it. So it's important for us to be mindful of what we put into our bodies, what we feed in our to our brains, and taking those steps each month, each day of our life to make sure that we're feeding ourselves healthy things, beneficial things.
Thank you so much. I just wanted to just let the audience know I didn't start the broadcast right away. So I want to do the welcome again and welcoming folks to Black Mental Health Matters. Again, our mission is to encourage open dialogue around mental health in the Black community. I'm your host, Ethiopia Ewart, and today our special guest is Pamela Hempstead, and we will be discussing aging and mental health. We are here to educate, inform, and discuss mental health issues within Black communities. Please note that this program is not a substitute for engaging and work with your own personal mental health professional. Please take care of yourselves. Also, feel free to use the chat to ask questions and let us know where you are tuning in from. So, Pamela, you gave an introduction, but can you do it one more time for me for our audience?
Absolutely. So, as mentioned, I'm Pamela Hempstead. I am a Christian and author, a two-time author. Just released my second book last month, and we can talk about that later. But I'm also a licensed clinical mental health counselor associate, and I'm a friend. And I'm excited to be here today.
Yeah, and I had mentioned how um I just feel it's so valuable you saying that you are a friend, because we often take on so many titles, and being a friend can be one of the biggest things that we can offer to this world, is being an
Absolutely.
authentic, honest friend to someone. So thank you for highlighting that. And you had shared about the importance of mental health as we age. Can you speak a little bit about the changes that can occur in our mental health as we get older?
Yeah, as I was thinking about this, there's what I've experienced walking into a room with intention to pick up whatever it was I was going to get, and and then getting there and not remembering what it was that I was there to get. So definitely memory loss for women going through menopause. There's weight gain, and I won't say that it's inevitable, but without proper planning, it can be inevitable. And the brain actually shrinks depending on how you're using it or not using it. And the part that shrinks is related to the learning center. So it's important for us to engage our minds in constantly learning. You're never too old to learn. You're never too old to change. You're never too old to embrace something different. And so I think that's important to recognize that those changes can be positive and negative, but we play an active role in engaging our minds, engaging our bodies so that we can be proactive instead of reactive.
I think that's really important as well. Like, um, as we get older, we can feel like we know it all,
Mm-hmm.
you know, but really framing it in that way of like each day being an opportunity to grow, for us
Right.
to learn, to keep that muscle, keep that brain muscle
That's right.
active, right? What they say, if you don't use it,
You will lose it.
you'll lose it. So yeah, thanks for highlighting that. Um, you mentioned some mental health issues that can arise as we get older. Um, in your opinion, how does aging affect the Black community specifically. There is research out there that talks about race-related stress and its effects on aging. Do you have any ideas about that? Anything you'd like to say?
Definitely. So we have the saying black don't crack, and in a lot of instances we look much younger than we are. But then there are those instances of all the trauma that we sustain over our lives. There is research referred to as the ACEs, adverse childhood experiences. And the findings are that people who have a high number of ACEs have high levels of illnesses, whether it be mental illness or physical illness, big ticket items like heart disease, like Alzheimer's, like dementia, cancer. And so when we continually sustain trauma, it builds up. And if we're not using the opportunity to work through that trauma with therapeutic modalities, i.e., a therapist, with talking about those experiences, if we're just holding it in, everything that we incur, when we look at the abuse that happens to men, Black men and women in the media, I think about the George Floyd murder. And I won't watch those videos because I'm very visual, and I hold that in my mind, and it plays over and over again. I have to be very intentional about what I allow my eyes to see because of the way my mind works. And so the impact of being Black and aging and the mental health piece, man, as those things keep adding on, you will find yourself snapping and going off on people who had nothing to do with the offense. I remember I was watching something about a person who I do not care for at all on TV.
Mm.
And my niece walked in the room and I snapped at her. And she was like, dang, all I asked for is blah, blah, blah. And I said, you know what? I apologize because I'm irritated about something else and I'm taking it out on you. And oftentimes, we aren't in tune to ourselves enough to recognize I've been abused, I've been mistreated. And rather than healing, I'm taking it out on my loved ones.
Mhm. When it comes to like racial discrimination, I know that there is literature that speaks about allostatic load, and the allostatic load being the actual wear and tear, the physical wear and tear on your body that comes
Mhm.
from psychological wear and tear.
Mhm.
And that, so with literature and academics, they don't say racial discrimination, they call it perceived racial discrimination, right? But that for Black folks, and the literature that I'm referencing is studies done in the United States, but with people of different backgrounds in the United States, but that the perceived racial discrimination then leads to a psychological stress that shows up in our bodies as heart disease, as diabetes. And one of the things that, like, when I started down that rabbit hole of literature years ago, I I was like, wow, it's like when you hear of the high rate of heart disease and the high rate of diabetes and specific types of cancers in the Black community, it really made me think of, like, man, Black people are dying of broken hearts,
Mhm. Yes.
or we're handed so much bitterness in our lives that we want to just eat the sweet and then
Mhm.
end up with a sugar problem,
Right.
and so I think, like, if we can talk a little bit more, I would love to hear your ideas on, like, how do we mitigate those instances. We know as Black people that we will experience racial discrimination.
Right.
Those things are outside of our control. What can we do as we are aging in our everyday lives? What can we do to help mitigate the effects of that stress? You mentioned Well, you mentioned like that, like you won't even watch certain videos. And
Mhm.
you also mentioned having an awareness of, like when your niece came in, you were watching something. Maybe you didn't need to be watching that person because you
Right.
don't really care for them. But like having, how do we develop an awareness that we can better take care of ourselves so that we can have a less of that stress, the impact of that stress as we age?
So I'm gonna take you on the 485 to get to this answer, and I might need you to remind me of the question. But
Okay.
when I was growing up, I was not given permission to be in touch with my emotions. So if I got in trouble, which would invoke shame, guilt, anger, and I'm crying and I'm not able to discern or even say I am crying because I am ashamed of what I did, or I'm crying because I'm angry that you spanked me. The response from the parent would have been, stop crying or I'll give you a reason to cry, or fix your face, or you're a child, you stay in a child's place. You don't get to articulate that. Okay, so there's that. The other night, I was reminding my 13-year-old niece, hey, it's 10 o'clock. You need to hurry up and get ready, get in the bed. And she said, TT, when you tell me that, it makes me anxious and it makes me angry because I know what time it is and I'm trying to get to bed. And I stopped. And at first, I was like, who is she talking to? But then it dawned on me, she's right. She is intelligent enough to know that it's getting late. She is hurrying. She doesn't need me to remind her of the time. And I laughed because I thought I can free her of what my experience was. And I said, you know what? You're right. And she said, and you do it in the morning. I was like, oh, okay, well, then I'll stop. And she was like, and I was like, okay, hold on, don't get too carried away now. And we both laughed.
Mm.
But I took a trauma informed care class, and the facilitator asked us what happy feels like in our body, what sad feels like in our body. And I couldn't answer that question because I've denied my emotions for so many years because that's what I was taught. My family, we could always handle emergencies. A situation goes down, we'll take you to the doctor, all of that. But then there was no time to talk about how that made us feel. When I was diagnosed with breast cancer and I shared it with my siblings, there was no, wow, mom died of breast cancer. This scares me. I'm not sure how to feel about that. It was, all right, when's your next doctor's appointment? What are we doing with the second opinion? How are we? No talk of the emotion because we didn't have time for that. We have to stop not having time to talk about the impact of the things that are happening to us. And we have to have those difficult conversations, along with the conversation of teaching your Black child what to do when they're pulled over, hands at 10 and 2. When the police officer asks for your driver's license or registration, you ask for permission to reach into the glove box and you move slow. So, in addition to that, we need to talk about the fact that it's not perceived racial discrimination, it is racial discrimination. If someone has spoken to you in a way that makes you feel disrespected, then you feel disrespected. You don't have to ask for permission to feel what you feel. Now, it's important not to wallow in those feelings, but to identify the way that that person spoke to me makes me feel disrespected, makes me feel overlooked. The fact that that person walked up and interrupted and talked to the other white person and didn't acknowledge my presence was disrespectful. And I feel that, and I get to feel that. So it's important for us to arm our children, arm the people in our circle with the ability to own what they feel and to be able to express it in a manner that is not matching energy, but is educating people. You know what? When you walk up to two people talking, it would be more beneficial for you to say, "Excuse me." Because when you talk over me, when you interrupt me, it makes me feel like you don't see me, and I'm too much woman to not be seen. And so I would request that you say excuse me at the very least. I What I'm saying is not too important for me to pause and allow you to say what you need to say, but I need for you to acknowledge me. We need to arm our people with the ability to articulate in a respectful manner and presence, so that when these things happen, not if, when they happen, they know how to respond. Maybe it's this person has said something hateful and I need to take a deep breath and then respond. I need to give my brain some oxygen so that I do not respond in my flesh. I am able to articulate in a manner that doesn't create escalate. It de-escalates, and then I can go take it out on some weights in the gym or a box or run or walk or whatever. But we get more done when we are able to talk through the offense and educate the offenders. And that's not to say that every offender is going to say, "Oh, my bad, I won't do that again," because chances are they won't. But at least you have created an opportunity to educate the people around you.
You know, you took me on 485.
Told you.
But it was a beautiful journey.
Yay.
So what I'm hearing you say is that it's important for us to practice acknowledging when
Yes,
we feel offended, when we feel those emotions, and to verbalize that.
absolutely.
Or even if there's not the opportunity to verbalize it, maybe just being able to acknowledge that I feel that in that moment.
Yeah.
I appreciate you saying that, and it made me think of you know, like you know, particularly as Black folks, we have these stereotypes that are bestowed on us
Yes.
that I think oftentimes it kind of puts us in this place of performance, right? I don't want to be
Mhm.
the angry Black person. I
Right.
don't, I don't, like even if we're not saying anything angry, people could be like, whoa, 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 you know what I'm saying? Like
Right.
if just
Right.
to acknowledge, like, listen, I didn't like when you did that. I'm like, whoa, whoa, whoa,
Mhm.
But I think that there is liberation in that.
Mhm.
It made me think of um something that I was speaking with my therapist, where it's like, with foie gras is fattened goose liver, right? And how they get the goose liver fat is they literally force feed the goose,
Wow.
right? So they are force feeding these geese to get this product that is like supposed to be this, or that is a delicacy amongst, well, particularly the French, but throughout a lot of cultures now, because French cuisine has influenced a lot of places.
Mm.
But it makes me think, it like I remember telling my therapist, like, so much of my life I felt that way, where it was like I just had to stuff it. I was getting stuffed with, and I had, like, I felt like I had no control.
Yeah.
I just had to accept it. I just had to take it. And it's just like, you know, being not having the opportunity to say, hey, I don't want that.
Right.
I'm not taking anymore. Well,
Yeah.
that's where I am now. So that's good. But
Mhm.
I think that that's an important thing for us to recognize, and that there is a liberatory experience in being able to acknowledge how you feel,
Yeah.
and then also to take to say, hey, I didn't like that. And I agree that it may not have been modeled for us
Right.
for whatever reasons. I mean, we can talk about, like, the enslavement of Africans in the United States, and how, literally you had to take it. Jim Crow,
Mhm.
literally,
Yeah.
right? You just had to take it. And as we have shifted, even though things are still extremely problematic within race in not only our country, because the idea of anti-blackness is a global phenomenon, right?
Indeed.
Um, but us being able to say more. and being able to be more in touch with how we feel and modeling that for the
Right.
next generation so
Right.
that they can experience that feeling of liberation, that they have a right
Mm-hmm.
to say, I don't like how I was treated, or that made me feel this way, and practicing that. um
Mm-hmm.
it makes me think when you said, well, don't wallow in it. I was thinking like, well, how do you not wallow in it? But then you gave us that. And I'm
Mm-hmm.
like, wow, what a beautiful way of not wallowing in it, because you've addressed it.
Mm-hmm.
And how when we don't have the opportunity to say anything, when we don't know how to express it, how it sits with us, it stays with us, we ruminate
Yes.
on it, it eats us up,
Yep.
it
Mm-hmm.
increases that psychological stress that then shows up in our bodies.
Yep.
So
And
yeah,
piles on. It just keeps piling on.
it keeps piling on. And you know it does require a level of practice. I just want to ask you, coming from the background that you have and now getting to this place with your niece, what was your journey?
it was it was interesting. I remember, so my firstborn niece is now 23, and her sister. And I remember she actually broke me in. She was the catalyst. And her younger sister just keeps me transitioning. But the older one, I remember I had told her, I don't know what your growing up experience was like, but for me, there was never any conversation about the family plan. It was pack your stuff, this is what we're doing. I didn't get a say. I didn't get it was just I was a victim of the decision. And I remember I had told my niece that we were getting ready to do X, Y, and Z, and she was asking all these questions, and I'm like, "Listen, do it because I said so. Don't ask me any. If you keep asking me, I'm gonna spank you." And she said, "TT, I know that you are going to spank me. So after you spank me, could you answer the question then?" And that struck me because that reminded me I wanted to participate. There were things that I wanted to contribute to the decision making. There were contributions that would have been beneficial, but I was not heard. I wasn't given the voice. And here she was saying, I will take the whipping, and then can I know so that I can contribute. And that was what broke me. I was like, you know what? It's time to do things differently. Just because my parents did it this way doesn't mean that I have to continue doing it. We can flip the script, we can change the whole narrative to make our children healthier and more whole. They don't have to grow up in the same broken environment that I grew up in. I, and that was what started it for me, my 23-year-old niece.
Yeah, it makes me think of what you said in the beginning of like how we have to keep exercising the brain, otherwise the brain will shrink. So
Yeah.
your niece, brought you something that may have been a little challenging in the beginning, but allowed you for reflection and growth.
Yes.
And I don't want to make any assumptions, but possibly better connection with your niece.
Let me tell you. And to that also, my 13-year-old niece, I remember when she was 10, I almost said, I'm smarter than you, because I was fussing at her about something. I almost said, I'm smarter than you. Do what I'm telling you to do. And I stopped and I said, currently, I am smarter than you in this particular situation, because this generation that's growing up, they're the first generation to never not have access to the internet. Their world is completely different. It is full of free flowing information from so many different facets. My 13-year-old niece talks to me about the news that she saw on YouTube. So we have to understand that the younger generation is going to be smarter than us in many areas. And so rather than fight it, we join, we unite, we arm. Yes, baby, you are highly intelligent. Learn that thing. Teach me. I have no problem calling my niece and asking her, hey, how do I do this? Matter of fact, I was in a meeting just this week, yesterday, and we were strategizing about what we wanted to do. We wanted to be able to make some videos on site, and they were like, well, how do we make sure that there's a microphone but we're using phones? And I said, you know what, I'm going to ask my 13-year-old niece, and I'm certain that she will have an answer. And sure enough, she said, TT, go to Amazon and search this. Do you know there are microphones that you can plug into your doggone iPhone?
Mhm.
I had no clue.
Yeah,
But if I had stayed stuck in, I'm the oldest, I know better, then I would not have found out about that. We have to be humble.
you know, all right, this is it's so rich, and it's like it's making me think of other things. And I want to circle back around to mental health and its effect on older age Black folks.
Yeah,
And in our community, we know that there can be a stigma around mental health, or even discussing anything around mental health.
definitely.
Um, what does that stigma do? How does that stigma affect older age Black folks?
It creates shame, and we end up suffering in silence. And suffering in silence can be the conduit to depression and anxiety and isolation. I am a health and wellness advocate. I have taught group exercise classes since 1986. For the past 2 years, I have been experiencing pain like I've never experienced. So I had breast cancer. I had 19 hours of surgery because of the fact that I have the BRCA1 gene mutation. So I had to have a double mastectomy and a hysterectomy.
Mm,
That was nothing compared to the pain that I felt before the surgery and after, which was related to then in 2020, I was almost bone on my right hip. And the changes of going from being super busy to the shutdown and being still and depression and trying to figure out how am I going to go through this thing, the muscle supporting my hip locked up, and I
mm,
was in excruciating pain. And then after I did a series of dry needling, and I am a proponent of that, but after, there were my knees. And I'm like, hold up. Don't I get some credit for all of the working out that I've done over all my life? Like, I've been working out since the 80s. How do I not get, how are you all not considering the fact that we've been doing work for over 30 years? What is this? And then what we do, what human nature suggests, is that you look around and you compare. Well, they don't have that. So there must be something really wrong with me. And I know it is definitely not a diagnosis, but there is a thing that someone said that's called obsessive comparison disorder.
mm,
We compare ourselves to other people, and when we don't match up to them, then it's got to be us. Now, we don't know what that other person has gone through or what they're doing, but it has to be us that's wrong. And so it's important for us to talk about what is going on with ourselves. It's also important for us, Black folks, we grew up taking garbage scraps and making meals because that's all we had. But we continue to do that. And we're eating garbage that is not beneficial to our bodies, that's resulting in arthritis, inflammation. And there's so much junk in the food that we're eating that we are ingesting things that are not beneficial for us. So some of the foods that we're eating are causing decay of our brain, causing inflammation in our bodies that prevent us to move. And so it just creates a negative cyclical situation where we are continuing to, we're eating these things that cause us pain. We're having the pain, we're withdrawing, and we're feeling bad about it. But then when you add that religious piece in there, I should be able to pray away my sadness. All I need is Jesus. And I'm here to say you can have Jesus and a therapist. You can have them both. You can pray And you can go see a therapist who can provide you some tools that will help you to come up out of that depression, because there aren't many people that can come up out of depression without some specific tools that will guide them.
Yeah, it's really important. I hear you saying that. Well, I mean, of course, I always like to highlight on the program that we have been taught that there's a dichotomy. The Western way of thinking of things is that there's a dichotomy between mind and body. When
It's all
there's
involved together.
yeah, there's no dichotomy, right? And so,
Meshed.
like, you eat stuff that doesn't make you feel good, right? And then you don't feel good. And then you're like, "Oh, I don't feel good." And it's like you said,
Mhm.
it becomes this cycle. And what I also hear you saying is that the importance of being able to have someone to talk to. So you mentioned in the very beginning about being a friend. And then I'm thinking about your nieces, and it brings me to like there's some stuff that happens in Sweden where they have like the younger folks live with the older community. It's like
Mm.
I think they can get like cheaper rent or something like that. Um, it was like I watched this documentary on this, and so it made me think about like how important it is to have like relationships
Mhm.
and relationships where you can be authentic,
Yes.
um, and you can share and say, hey, I'm feeling this way. I'm feeling nervous. I'm feeling scared. Like you said, with your siblings and with your diagnosis of breast cancer, everybody went to action, but not to emotion,
Right.
And sometimes we'll go to action because we don't want to deal with emotion,
Yeah. Yeah.
but just highlighting the fact that it's so important for us, um, at any age, but particularly as we get older, to really find that place of authenticity and finding that place with authenticity within our relationships.
Absolutely. And the older you get, the more people you lose. And grief plays a big role in mental health. Uh, I thought that after I conquered breast cancer, that I would be safe for no more problems for at least 10 years. Like, Lord, let me just chill for a minute. And last year, June 11th, 2021, I lost my brother who was 4 years younger than me suddenly. He died of a massive heart attack while on a bike path. And in 2020, when I was diagnosed with breast cancer, I had to learn how to give myself permission to cry. In 2021, with the sudden loss of my brother, I had to really figure out how to grieve in a healthy way. And I could not do that by myself, even though I am a mental health advocate. I couldn't do it alone. And so, literally, I was doing what I knew to do, which Black folks, we work, right? We get the job done. We do what needs to be done, but we don't stop and recognize I'm hurting. And I remember, like, literally the day of my brother's funeral, I get a call from my boss's boss who didn't even know what was going on with me. That's how I was operating. I was working still. I only took that one day off. And at the end of the week, a coworker called and she said, "What are you doing? Why are you working? You know, we have bereavement days. You need to take some time off." And I remember when she was saying that, I recognized that I was in depression. It was completely Black. And I reached out to two different therapists and I said, whoever responds first is who gets me. And Edward Blevins got me, and he was available literally the next day. And he armed me with something that I share with as many people as I possibly can. After I told him, that I grew up raised by strong Black women, my mom and my granny, I saw them go through crazy stuff, not shed a tear, not say I need help. And so I had to follow their path. I look exactly like my mom. There's no way I can look like her and sound like her and not be like her. And he said, "What if I told you you could live in the land of and?" I said, what is that? He said, you can be strong and cry. Now, that sounds like such a simple concept, but it gave me so much freedom because I never associated crying with strength. And so sometimes we need to see someone who can provide words that free us up from our past and our teachings, what we've learned, our creed may be jacked up because we learned that creed from somebody who was in a jacked up environment and who was adapting and did the best that they could. And so it's important for us to free ourselves of the the wrongs, that the dysfunctional stuff that we learned, and grab onto the new stuff that's more beneficial.
Yeah, I wonder for some folks what, like what is the entryway when
Mm,
you have gone so much of your life, you know, like my granddad, he died last year. He was like 101.
mm,
And yeah, he was that dude that was like, well, I've been doing it like this for, however long. Like
mm. Yeah.
you can't come in here and tell me nothing.
Mm-hmm.
Nothing.
Mm-hmm.
But I think as it was unfortunate because COVID was, it was like we were on all those protocols with COVID, so I couldn't even get a chance to go visit him when he was dying. But I think if that when he got to that part, that's when he was more open. You see what I'm saying? For like how do we engage? How do you engage a community that is facing stigma, that has a whole lot of trauma, a whole lot of suffering, and a whole lot of like, you keep your head up, you keep it moving, you don't slow down, you don't talk about it, and they've lived most of their lives that way. What do you have any ideas around that?
For me, it took being so low that I couldn't see out and get myself out by myself. It took humility. It took me being comfortable with saying, I need help. For some people, it may be seeing that they keep walking around in the same circle and getting the same outcome, recognizing that they're doing the same thing. And that is the definition of insanity, doing the same thing, expecting a different outcome. It takes a person that says, I'm willing to try it differently because what I've been doing is not working. It takes people who are willing to be transparent and share their experience. It takes your podcast telling people you've got options and teaching people that it's okay to try something different and it not be the right thing, but to be open to keep trying. Because I could have, with my 23-year-old niece when she was 9, I could have said, okay, well, I'm gonna spank you and I'm still not gonna tell you. I could have chosen that route. And who would she be at this time? We have to be mindful that our children are our future leaders and we arm them with tools or we disarm them. And so it takes someone to recognize that this thing is bigger than me. If I get it right, I am creating beings who will go out and do bigger and better than me.
I want to I want to say this, Pamela, like, yeah, we can think about like how it affected your niece. But you made that choice. How did it affect you? What did
It,
it open up for you?
yeah, it reminded me that I don't have to follow in every footstep that my parents made. It reminded me and emboldened me and empowered me to make changes that were beneficial and trust that, because oftentimes when we've been raised by parents that we respect, that we trust, I know for me, I respected my parents, I trusted them, and I saw the path that they left and the fruits of their labor, and I wanted the same thing. When my father, the man that I knew as my father, when he was preparing to die, he knew that he died at the age of 48. And he set up everything for my mom. Like, she literally didn't have to work, but she chose to work. And when my mom was preparing to die at the age of 54, she had everything in place. And so, wanting to do those things, wanting to be prepared, wanting to be that voice of wisdom, while I didn't have children, I have my nieces. I made those choices to recognize, okay, I don't have to do everything that they did, and it's going to be all right. It's choice. It's just being open to doing something different.
Yeah, I just wanted to just like explore that a little bit more, because I think that we can always look at, the benefits in like, I decided to raise my children differently than I was raised. I'm practicing conscious parenting. My children don't get hit. I try not to yell at them. Sometimes I do.
Right?
Um, like, try not to shame them and these kinds of things. And it's a
Mhm.
benefit to them, but I also recognize the benefit for me,
Yes.
and having, like, really being able to show up in a way that's more authentic, right? I don't have to put on this stony, steely
Yeah.
persona and be like, well, I'm always right. And, just figuring out a way to make it, because I'm the authority, and you're the child, or, like
Mhm.
that hierarchy type of relationship that exists so much in our culture globally,
Right.
right? Where it's just like, well, I have control over you, so I'm not wrong, or I can hurt
Right.
you, or but it allowed me to go deeper in my process with myself, and how
Mhm.
I parent myself,
Mm, mm.
and how I can be gentle with myself. And I think that that's an important thing for folks to know, that, like, when you shared that, the first thing I thought is like, wow, look at what that opened up. Look at what your nieces opened up for you.
Yeah. You said gentle with yourself. I want to just pause right there because we're not gentle with ourselves. We beat ourselves up. Uh, there are studies that talk about how we have 12,000 to 50,000 thoughts per day, and over 80% are repetitive. There's a high percentage of those thoughts that are negative, that play over and over in our mind. We beat ourselves up. You know, Jesus said, love your neighbor as yourself. Well, you have to have self love in order to give love to someone else. And oftentimes we will love our friends. We will be gentle with our friends. Our friends make a mistake. Girl, it's okay. You can try again, get up, dust yourself off. But we beat ourselves up. How could you do that? How could you be so stupid? What were you thinking? I'm such a this, I'm such a that. I'm not enough this. And all that plays in our heads day after day after day. And we walk in that. We carry ourselves in that. And so, being gentle with ourselves. Last night, I completely forgot an appointment that I had. It was an opportunity to make some money, it was an opportunity to do well, and I forgot. And and for a moment, I was disappointed in myself, and I allowed myself to be disappointed. But then I reminded myself, I have so much going on. I need to slow down. I need to love on myself. I need to be still so that I don't make those mistakes again. I chose to allow myself to be disappointed, but to also love on myself. And I think that's a significant missing piece.
Um, I want to explore, um like, we spoke about, like, some of the barriers that to care that exists in the Black community that are, like, self-promoted, right? We have well, in some ways self-promoted, because the stigma, I don't know if that's a self-promotion, but, like, us not engaging with mental health. But can you talk more, or speak to the systematic barriers that exist for mental health care for older aged Black folks?
Absolutely. Outside of ourselves, we have those doctor's visits where rather than the doctor allowing space, and they're getting a little bit better, but rather than them allowing space for, well, have you considered seeing a therapist? They go straight to medication. Oh, you're feeling a little sad? Okay, how about this? How about you take these pills that have side effects that require you to come back and spend more money and be here? I see that as a significant barrier. Then there's, again, going back to the church, when you have people who are tying themselves to the concept that they shouldn't need anything else but Jesus or prayer. If if I'm hurting, I should be able to pray myself out of this hurt. And they do themselves a disservice because we all have purpose. We're all here for reasons. And so we have the opportunity to utilize all of those resources and tools. And so I think there is that disconnect between, like you said, thinking that they're two separate entities when we are body, mind, and soul all intertwined. We have all that going on, and the things that negatively impact my mind will also negatively impact my body and my spirit. And so, yeah, that would be my answer because I recognize we're running out of time.
Yes. Do you have any ideas on how older age Black folks find culturally sensitive care?
Yes. First off, we advocate and raise them, okay? Rather than sending our children to football and basketball and the like, we encourage our children to become what we need. We need more doctors. We need more Black doctors, Black therapists, Black folks who are going to be mindful of the experience that we have. We've got to. And we can't be so trusting. Just because a doctor said it doesn't make it so. I remember I had gone to the doctor and he said, you need to lose some weight. You need to lose about 50 pounds. And I said, I agree. He said, okay, so I'm going to put you on these diet pills. I don't want any diet pills. He said, no, you don't understand. I sit on the board of at Harvard University. I know how this works and you need this pill. And I said, I didn't take a pill to get to this weight. I'm not going to take a pill to get to where I need to be. And so self advocacy, looking for a second and third opinion. If what the doctor is telling you is not consistent with what you want to do and you know your body, then don't be afraid to say, I'm going to ask another doctor for another opinion. If you don't feel accepted or cared for at the doctor's office that you're currently visiting, you've got options. There are other doctors.
And I'm like, yo, say that again, because I think it's the same thing with the goose and what we were talking about earlier of just sometimes we don't even know that we can go get a second opinion. Sometimes we don't even know, or we have been so conditioned to be like, all right, well, this is where I am, this is where I got to stay. And we deserve good care.
That's right.
I mean, I'm not going to go down that path, but Dr. Tanisha Freeman Foster, who was a guest on the last show I co-hosted, she said that sickness is a form of control. Because when you're sick now, whether you're in the hospital, going to the doctors and the pills, or whatever, it's like now you're being controlled in a way. You see what I'm saying? And I think that
Absolutely.
is so important. Like tying it back into what you said earlier about like being able to be in touch with our emotions, practicing, advocating for ourselves, saying, I don't like when you did this made me feel this, and I didn't like that, or I didn't appreciate it. It permeates everything.
Absolutely.
Not just our interpersonal relationships, not with our siblings or our friends or a family or whatever, but our coworkers, our doctors.
Mm-hmm.
You know what I'm saying? The cashier.
Yeah. Yeah.
You see what I'm saying? Because that's how pervasive, like bringing it back to this discrimination, that's how pervasive it is. Like oftentimes Black people are just straight dismissed.
Yes.
And particularly in we're speaking about mental health, and things can be misdiagnosed so easy.
Mm-hmm.
That's what the literature shows us, is that it's a lot of times folks are being misdiagnosed. So knowing that you can get a second opinion is a very important thing. So thank you so much for
Absolutely.
highlighting that.
Absolutely. Yeah, I was just I've been dealing with plantar fasciitis since the beginning of this year. Well, I was told that it was plantar fasciitis, right? And so it has moved up to my ankle. And I went back to my physical therapist who does my dry needling, or who did it in 2020, yesterday. And she said, that doesn't look like plantar fasciitis. That looks like tendonitis in the ankle, because my ankle area was swollen. Let me tell you, she did some needling in my calves, and I literally had no more pain in my foot.
Hmm.
But had I stuck with what the doctor said, plantar fasciitis, I would have been on a totally different journey, treating something that was not my issue. And so it's so important for us to be okay with challenging what we're being told. It's not the end all be all. Just because the doctor said it doesn't make it the truth.
Yeah, and I do want to acknowledge that not everybody has the same level of resource, and advocating for yourself is still extremely
That's
important.
right. That's right.
It's
Yeah,
extremely
even
important.
if you are going to the what is it, the county board medical health department, you still have the right to be treated appropriately. You are a patient. You're not a number. You're not a piece of paper. You're a person. And so advocate for yourself. And advocacy is, there are ways that you do it. Like, you get more with honey than you do with vinegar, right? So when you present in a manner that is consistently nice, but letting them know, I'm not going to accept that treatment. I was talking to some teenagers, and they wanted to know how to build relationships with their teachers, which caused me to do some research into the generations. And I was talking to them about, if you when you talk to your grandmother, she's expecting that front facing conversation. When you're talking to baby boomers, they want to talk face to face. But when you talk to my generation or younger, they might be okay with a text. And so just recognizing the type of communication is important, so that you are able to get your point across. You will not be able to advocate for yourself if you are cussing that person out, because they're not going to be able to see past that. But if you are letting them know that what they're telling you is not acceptable, they're going to have to receive that if you're doing it the right way.
Yeah, I'm a person that advocates very passionately. I agree with not cussing though. Don't do that. But I also agree, like, sometimes you have to, like, I've been in situations where people were like absolutely. So as a licensed clinical social worker associate, I'm governed by the ethics, right? And one of the statements in the ethics is that I'm here to treat my clients with dignity and respect.
Yes.
So if
Yeah.
you're dismissing me right off the rip, just off, yo, nah, that's not dignity and respect. And I think that that is something that, if we know that this is what we deserve, dignity and respect, then how you deal with me as the doctor, like when you go in, we only got a couple more minutes, but ground yourself with that you deserve dignity and respect. um in these last couple of minutes here, can you share what are some ways that folks can take best care of their mental health as they age, and if you have any little tidbits for older age Black folks in taking care of their mental health?
So I would say, move away from, this is how I've always done it. Move away from, I'm too old to change. You are at whatever age and you are capable of learning, of changing, of doing things differently. Just because you grew up with people who did things a certain way doesn't mean that you have to continue that path. Be open to doing what's beneficial for your mind, your body, and your spirit. Look at the foods that you're eating, because what you eat impact your mind. They really do. And work to educate yourself on what you're putting in your body. Be comfortable with, or get comfortable with, saying, I need help. Even if you have to just say it in the mirror in the bathroom by yourself, I need help. I don't think I can do this by myself. I need help. Say it a few times a day so that when someone says, what do you need? I need help. And this is what help looks like. Help looks like, I'm feeling a little lonely today. Can we do X, Y, and Z? Recognize what's going on with you. Assess yourself. Free yourself of the requirement to do it all by yourself. Just be free and recognize that there is power in unity. We were created not as independent beings, but as interdependent beings. That means I need you as much as you need me. And so you work with your circle. Make sure your circle is healthy. Make sure that you have people in your life, or find some people in your life that will affirm you, that will say, you know what, Pam, you don't seem to be functioning the way I know you to function. What's going on? You seem a little down, you seem a little quiet. You're not always quiet, so what's going on? Someone who is going to be checking for you, someone who's going to call you on it. Hey, listen, I've never heard you say I need help, but it appears that you need some help, so what can I do? Those are very important factors. But just recognize that no matter how old you are, it's not too late to do better. It's never too late. As long as there is breath in your body, you can make significant changes that will create a better you for tomorrow. But start today.
Thank you so much for those wise words. Um, we have reached the end of our program today. You are watching Black Mental Health Matters. Today we were talking about mental health and aging with the lovely Pamela Hempstead. So thankful for you showing up today. Thank you to the audience, to folks watching, and we will see you next time. Have a good day.
Ethiopia.